Hi, my name is Matt Hess, and I work for the AHEC program office at the Anschutz Medical Campus. I'm also married to a nurse who works at a primary care clinic here in Lafayette, Colorado.
Well, thanks, Matt, for spending some time with us today on our COVID-19 pandemic share the story. So how has your life changed other than the beard that I see that you have now?
I've had the beard, but it's getting longer. We call it the quarantine beard.
Mm-hmm.
But I think for me, the biggest deal is just that, I've shifted to working from home. I also have teenage daughters. They're 14 and 16. So they're in the house with me all day, every day. They are really self-reliant in doing their schoolwork and getting online and doing it that way. But just being in the house, working remotely definitely is a big shift.
What do you see as life-changing experiences from this COVID epidemic?
That's interesting. I definitely think this is going to be, a big point in time that we look back on and say before and after. Definitely from my daughters growing up in the middle of this, that's going to be something that defines their teen years, and assuming they remember. As a family, I think it's allowed us to spend more time together and grow closer in a lot of different ways, which has been really neat. And then, personally, I think that it's also gonna shift just the way we work, and definitely the resources we've got available to do the work of AHEC and the work of universities and the work of healthcare educators. We're seeing new resources come online, but we're definitely seeing cuts in funding across the board. And so that's going to be really concerning, or it is really concerning, as we look towards increased healthcare needs, both directly from COVID, but especially from the ramifications of all the folks who aren't getting care right now and all the folks that are experiencing various social determinants that are impacting their health.
As a health educator, how is this going to make your job different in the future?
I think there's a few things that are happening. One, we're moving towards more online learning and discussions, and some of that is really valuable. I think especially in terms of our reach, we're going to be able to connect to folks through a lot of rural areas, but then we do know there's a lot of rural areas that also, so in terms of the rural folks, some of them are getting access to learning that they haven't before because so much is going online. But then there are, big sections of our rural communities that don't have access to broadband internet and are cut off from that as well. So, so that's something we're trying to understand and we'll be adapting to for a while. And then as someone who is interested in supporting and recruiting for the healthcare workforce, I think it's going to be very interesting. I'm not quite sure how it's going to pan out. I think there are some young people who right now are hearing that healthcare workers are heroes. And so I think they're going to have interest in the healthcare field. But I do know people in healthcare are also experiencing burnout and stress and working harder, or and then still being asked to take pay cuts or being furloughed, especially if you're in dentistry right now. So I think we are going to see some of those folks maybe drop out of the workforce, the healthcare workforce, where they just realize it's not for them, or it's a time of trauma, and they want to deal with that by moving on to something else. So at least in terms of somebody that's interested in the healthcare workforce and education around that. I think there's going to be a lot of things that develop out of that. I'm not exactly sure how it's going to all flesh out, but I think there's going to be some things around both of those factors.
Are you seeing disparities in education as it currently, and just information as it currently is being disseminated to urban and rural areas in our state?
In terms of the COVID crisis?
Yes.
I don't know. I think that's one of the things that's hard to know what you don't know right now, because those folks that are isolated are even more isolated. A lot of times the rural folks are the ones that rely so much on the in-person. And that's not happening right now. So it's hard to say what's getting out there. I do have concerns in terms of rural folks. We know that funding is not getting evenly spread out. It takes longer to get out there. I do think it's also going to be interesting to see it if rural does get hit with a wave. I haven't looked at the statistics lately, but the urban areas were hit first. We are expecting rural areas to get more cases of COVID soon. So depending on how that pans out, I think will be interesting too. I know your question was around the information, but I guess my thought is maybe that part of it is that information and resources to some degree are following the cases. Some degree it's just a free for all right now too, in terms of people trying to get all the resources they can.
In talking to a lot of rural care providers and those of us who live in the rural area, so many people are getting their information from radios and TV stations in the adjoining states. And while all that's happening, amazing information is coming out of CU. Do you see a disconnect in where rural people are really getting their information right now?
Yeah, again, I don't really know where rural people, I don't know. I think that's part of it, is I think we are disconnected from those channels of communication, because we're we're all shifting to this working from home online environment, and so I think there are those disconnects because we just aren't able to get out and visit communities like we used to. So I think figuring out how to maintain those social networks right now is really important, but tricky.
Let's switch gears a bit and talk about current challenges you're facing. What's it like to watch your spouse go to work every day in a medical care facility? How does that translate to home and what you're seeing?
I think there's a couple things that we're seeing at home. One of the biggest ones is it's almost like she started a new job. And so when you start a new job, your brain is working extra hard. You come home extra tired. You're kind of frustrated, trying to figure things out. And then also starting a new job where you're not really even told what the job is, because, it's changing so quickly. So, she moved from working inside on a pod with, specific providers to pretty quickly being the person that sits in a tent out front every day. And as people drive up, letting them know they can come in, or they, we're not taking patients right now with, they're only taking patients that have certain kind of critical, not in the critical care sense, but There's only a few categories of people who are getting treatment right now. Like well baby checkups are one of the few, or prenatal kind of care, but your basic yearly checkup isn't happening. So she's sending people away, or taking temps and letting them know they're qualify for a COVID test, or sending them to the hospital if it's real emergent. So that's just kind of really been a big shift in her role. We do feel like at her clinic, just Clinica in Lafayette, that she's been reasonably well equipped with PPE and the supplies they've needed, and they've been scrappy in terms of figuring out how to get the resources they need to shift to this kind of environment. But then at the same time, they did have to furlough a lot of their coworkers, and so that's just really sad and hard to see. Again, mostly from the dental pod, but then other folks that they just can't afford to keep on right now. And so I think that's something that the news hasn't been catching. That, and I'm not a news fanatic. I don't do cable news or listen to a lot of radio, but check a few news stories just to kind of hear what's going on. And the number of healthcare providers who, healthcare professionals who are being furloughed right now is pretty significant, and something that really concerns me, because that's just number one is one more thing that's wearing on the well-being of the folks that are there. It's a little bit of kind of survivor guilt going on top of everything else. And then, just in terms of what we need in terms of, especially in that kind of environment, of those folks who are already are at significant need for the full spectrum of healthcare. Not having it now, and then there's going to be a major rebuild of our healthcare infrastructure as we get going again. So, so that's both practical concerns as well as just the emotional concerns and where that she brings home, and that I share with her.
So how do you keep it together?
How do we keep it together?
Mm-hmm.
I mean, I think for one thing, we know that we're fortunate. We know that, we've got older daughters who can take care of most of their educational needs. I've got friends and other people I know that have, elementary school kids that take constant attention. And so, we do try to, we also feel fortunate that we now have a little bit more time together. She comes home for lunch and I'm here. The clinic's only about a mile away, so we can drop them off special Frosties or something, things like that, just to kind of give a boost. But yeah, it does definitely start to feel exhausting after however many weeks we've been doing it, and then realizing that some of this is going to go on for quite a while, and the uncertainty of it also, I think, is wearing.
How do you think this is going to impact your girls and what they choose for a future career?
I don't know in terms of career. I do think that we're going to have a generation that's a little bit more cautious, a little bit more looking for security. Thinking back to like my grandparents maybe who remember the Great Depression, that kind of period, and not that we're at that level of financial need right now, but just realizing that things are things can get unstable very quickly. So we'll see. I do know that for them, working from home is going to be not a natural thing for sure. They're going from, they move pretty seamlessly to doing their schoolwork online. So yeah, I'm not sure in terms of jobs for them. Neither of them were interested in healthcare at this point. But, so,
Have you heard or seen, other than your wife, stories of heroism and people just doing amazing things that they otherwise would not have done? Are you experiencing any of that?
in terms of healthcare, or in terms of just in general?
Just in terms of in general.
To me, I think what I've been impressed with is not necessarily the giant strokes of heroism, but the little things. In our neighborhood, we've got a lot of little free libraries. And so people are stocking those with toilet paper and canned food, and just seeing the ways that, ironically, I've got to know some of my neighbors better at this time. A woman who lives by herself, who we kind of wave at, and she's got really cute dachshunds. Takes on walks around the block, and they walk behind her, which I always think is funny. They're like, "Come on, Mom, do we have to go?" But she has talked to us a little bit more, across the fence down, as we walk by her house, or she walks by our house, and she said, if I get sick, I'm putting a card in my window, and if it's green, I'm okay. If it's red, come check on me, kind of a deal. So, just those little things are what I've noticed. And I've got a community garden plot across the way, and last year we didn't know a lot of the other gardeners. This year we seem to get to know all of them, even though we have to yell at each other from 20 feet away with our masks on and stuff. It's an interesting way that just those little things where people are coming together that have been impressive to me.
We've seen the universities completely go from face-to-face didactic experiences to online experiences for the students. And we're hearing stories about people doing entire educational experiences through their phones. And how do you think that's going to affect us in the future when we're looking at our programs? And how do we reach out?
Yeah, I could look at this a couple different ways. I am actually a student. I'm working on a master's of social science. I'm in a class right now once a week, and we meet on Zoom. And I would say that experience hasn't been super, super smooth. I definitely feel like we're missing out on some in-person time. Even those just kind of side conversations that I would look forward to walking back to our cars after class, getting to know people that, I don't have a lot of other kind of interactions with, from groups that I just don't have a lot of interactions with. So that kind of side learning is hard. But and then, I really am an educator that kind of follows a critical pedagogy, where I really feel like knowledge is learned in community. And so there's concerns about how you make that happen in a virtual environment. But I do think that there are opportunities. I think that we can learn a lot about how we can motivate folks to be open and vulnerable and share ideas in those kind of spaces. Tomorrow we're doing a virtual COVID debrief with our AHEC scholars, and so excited to see how that goes. And then some of our online modules are getting more traction than ever. So I'm excited about the ways that we can connect outside of geographic space, but I do have concerns about how we really get to some of those deeper levels of learning. Paulo Freire, critique to the banking system of education, which we can do a pretty good job of, dumping information from one person to another over a virtual platform. But in terms of that co-creating knowledge together, it can be done really cool virtually, but it takes a skill set that I'm still learning a lot about, and I think a lot of people really need to do. And just like any change, we've got educators that are gung-ho and real excited about it, and then those that are just not going to go, they just will refuse to try to make it happen, or can't quite think in those terms. So, and then, just technology-wise, just it's not where they've been investing their learning for so long. So it's going to be a major shift, and because some of it will go back to the way it was, but there already was a push to move online, and so there definitely is going to be more of it done that way after this.
Is there any part of you that just wants to shout to the world, "I told you so"? You have been taking the lead for the last several years on creating online learning platforms. You've done it through the AHEC Scholar Program. Your team has done it through opioid education, and you pushed it. And you said earlier, all of a sudden people are really excited about that and getting into it. And I've heard you say over and over again, it's a platform. How are you going to change it though? How are you going to change it now that you've had your COVID experience?
I don't know if new things need to be changed. I think like I said, it's both. There's both positive and negative. So I'm not 100% gung ho. I would love to be in person as much as possible, but there are some really cool resources that become available when you break out of the geographic limitations. I think for me, it's just diving down and trying to figure out how do we really build those authentic relationships. And I haven't quite figured that out. I think, the meetings that I'm having now, the things that are flowing well are the ones where there were meaningful personal relationships before, and then picking up some of these, Zoom calls or phone calls or, other things happen more smoothly. So I think that what needs to happen is there needs to be kind of that back and forth still. I think the virtual will be a tool that we're going to be able to use better, but without the personal touch, we still lose stuff. So I think, and that was something I was aware of and convinced of before, but now, even more so.
How do you want history to record this event?
I think I'm also a history guy. My undergrad was in history, and so I spend a lot of time thinking about how we teach history. And a lot of times the way we teach history ignores the experience of regular people, or folks who were experiencing oppression in certain periods, where we try to limit that. And so I think this is going to be just like all those other histories where we can focus on the big players, the big names who get in the news regularly. But the story that interests me the most is kind of like what you're doing. That's one part of it, is just the stories of the folks that are experiencing history as citizens, as neighbors, as families. But then also those folks that are hardest hit by the crisis that are out of the news. We're just starting to understand how especially Black folks are getting hit harder with the pandemic directly, and then we know people of color are going to be impacted by the pandemic indirectly. So I hope that somebody's catching all those stories and documenting all that piece too. I know there's some, but I imagine there's not enough.
When we look at where will we be in 6 months, you're going to be sitting in your basement talking to me in 6 months?
What's that? October? I mean, we just have no idea. I think I'm definitely planning on it for 3 months. But there definitely can be more, I mean, the epidemiologists are saying there could be other waves and other things happening. So I just have no idea. And I think that's probably what's most challenging for me. Is I'm a visionary. I like to plan. I like to think, okay, what can we do? And so change and uncertainty does offer up some opportunities, but it also is exhausting.
Other than exhaustion, have you learned anything new about yourself that you didn't know before?
I think so. I think I'm still figuring it out. Overall, I like the experience of a lot of things I can do from home, but definitely at this point, I'm ready to get out and see some people.
Yeah. Ready to go out and have dinner. Take your family to dinner someplace.
Yeah.
Yeah, to have normal.
Just go around and talk to people.
How many days has it been since you've been quarantined?
I don't know. It's been at least, I think it's been 5 weeks now. But I've lost track. So I have to go back and look. I can't remember the first day that we stopped going back to the office, at least.
Well, you said you were an optimist earlier. So if we're also quarantined in a couple months, can I come back and have another chat with you? We can see. Sure. We see if we had any great life-changing experiences from all this, and move forward.
Yeah, definitely. Yeah, there's definitely a lot of reflection that still needs to happen. You think you'd have a lot of time to reflect while you're in quarantine, but it just is also, I don't know, it's hard to process it all, even though you're alone. So, and I'm not really alone. I've always got my family around. So,
have your daughters taught you to dance or anything like some of those other fathers we've seen highlighted in the news?
No, they would be too embarrassed of that either.
What's
We're
been
having fun together though. We've been playing games, and we bought chickens. So I haven't had chicken since we moved back to Colorado.
okay?
But we've been building them a chicken house. And so they've got a new chicken coop. It has glass doorknobs and pink flowery things on it. So
Maybe you need to start a contest to see who can make the prettiest chicken coop in the city.
yeah.